It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
Back to the show. Our next guests are Dr. Chris King and Londa Rose, a 51-year-old soccer player and CrossFit enthusiast who showed signs of nothing other than great fitness until she got heart disease. We're going to talk with her and Dr. King. And here are Shannon O'Kelly and Dr. King right now.
Dr. King, Londa, welcome to Health Talk. How are both of you doing today?
Doing great. Thank you.
Thanks.
Well, thanks for joining us. Dr. King, tell our listeners about your practice. You're a cardiovascular surgeon. Is that pretty fair to say?
That's correct. It's exactly fair to say. I practice heart surgery over in Bremerton, Washington at Harrison Medical Center.
And what's your practice? Give us a day in the life of your practice. What's your specialty area? Do you have a focus? Do you treat all cardiovascular disease, or do you have a subset of your practice that you're particularly interested in?
We treat the entire spectrum of cardiac disease. In my practice, I'd say I operate or do heart surgery about 4 times a week, and then see patients in clinic about once a week, and then take care of any heart disorders that come our way.
And for our listeners, I mean, statistically speaking, I think heart disease is at the first or second leading cause of death. It's up there. It's fairly high in the U.S., particularly with obesity, lack of exercise and movement, et cetera, et cetera.
Correct. It's definitely up there in the top 2. I think there's a competition between that and cancer, but heart disease is probably the number 1.
It's definitely prevalent. Londa, you have a story, and your story is kind of interesting. And then why don't you jump in here and kind of tell us your background and your history, and then we're going to kind of weave Dr. King in here with some anatomical and physiological stuff, because I like anatomy and physiology, right? Londa, welcome.
Oh, thank you. Yes, so I had I noticed an earlobe crease. I had this odd little crease in my earlobe, and I don't wear heavy earrings, and I didn't know what that was all about. So I went online and did a little research, and you shouldn't believe everything you read online, right? But yes, and it said it can be an indicator of heart disease. And so I thought, boy, I better go talk to my doc about this one. And so I went to my doctor, and she took a listen, and she said, "You have a heart murmur."
Oh,
wow.
wow.
Wow, I know. And then she sent me for an echo. I went for an echocardiogram, and they diagnosed I have bicuspid aortic valve is what it's called.
That's interesting, because I can imagine right now all of our listeners are pulling over on the side of the road right now, if they're on the road, and they're checking their earlobe. Right? You know, can you imagine that?
Yes, I know.
Dr. King, jump in here real quick. This is good. We're getting in and out here. Tell us from an anatomical standpoint, earlobe crease. What's going on there?
So Londa's actually really fortunate, because her actual cardiac disorder had very little to do with the fact that she had an earlobe crease.
Oh, interesting.
Interesting enough, earlobe creases are associated with early or higher incidence of having coronary atherosclerosis, or just heart disease of the blood vessels contributing to the heart, whereas Londa ended up having a heart valve problem, which was a very fortunate finding for her.
2 different things.
Correct.
So when you talk about atherosclerosis, you're talking about the plaque forming in the lumen, or the inside of the pipe, or the
That's
artery.
exactly right.
And then a valve problem is usually some kind of dysfunction in the 2 valves, and a bicuspid valve. Tell us a little about anatomy of the bicuspid valve, because you replace these things on a regular basis.
That's correct. Aortic valve usually has 3 cusps in most people, but bicuspid valve is not that uncommon, and does have a predominance to happen in certain families that are at risk for having bicuspid valve disease. It's a congenital anomaly, or one that it happens at birth, and then you carry it along to some varying degree throughout your life, and sometimes you discover it on incidental exam when somebody listens to you with a stethoscope and you have a heart murmur, and sometimes that murmur can go just watched for a long period of time, but eventually sometimes these valves need to be replaced.
Exactly. So just kind of review here. This is fascinating stuff. I love anatomy and physiology and biology. The human body is so impressive, and you work with this incredible organ called the heart. It beats, 72 times a minute, every hour for, let's say 78, 80 years. Pretty amazing machine.
Yes, it's something that you want to go for you for a while.
Good point.
Exactly.
Excellent point.
Mm-hmm.
Did you hear that out there? You want your heart to go and go. And that's what you're all about, is helping these hearts go. Now, what you're talking about is normally this valve has 3 flaps, and some people are born with 2. Let's just walk through this.
True.
And as a result of only having 2 flaps versus 3, blood will leak in and back and forth maybe during this pumping of the heart, which causes that thing you pick up with a stethoscope called a murmur.
Correct.
I'm doing pretty good, aren't I?
You're doing great.
Yeah.
That's exactly what happens. And the turbulence created by the unusual heart valve then is what actually leads to sometimes calcification of the valve, and eventually narrowing of that valve as well. So that's why it needs to be followed over time.
We're going to continue our conversation with Dr. Chris King and Londa Rose, talking about the topic of heart disease as we continue with IRG Physical and Hand Therapies Health Talk. We'll be back right after this timeout, right here on Como.
It's a Northwest lifestyle weekend on Como News. Now back to IRG's Health Talk.
We're back with Dr. Chris King, Londa Rose. We're talking heart disease right here on Como with Shannon O'Kelly.
Dr. King, thank you so much. Fantastic job setting it up for our listeners on the anatomy and physiology of this valve. I'm going to talk to Lana now because you had no symptoms. I mean, if you didn't find this earlobe crease and didn't follow up, you would have gone without being diagnosed or having some corrective surgery performed.
Right. I had no idea. I've had 2 brain surgeries and was never told that I had any sort of heart murmur or anything. Yeah.
No symptoms, no short of breath.
No.
Nothing.
Play soccer 3 times a week, nothing.
And no one in your life ever, when they listened to your heart, said you had a murmur?
No.
Yeah, because, I mean, it's interesting because so many young kids during high school physicals, I remember growing up, during the physical, kids would come out of the gym after we got our physical and they said the doctor said I had a murmur. No big deal. No one looked into it. But I think in today's world, I mean, if you talk to Dr. King, he'd probably say murmurs need to be followed up. Is that fair to say?
That's absolutely correct. And it should be on at least annual basis with annual echocardiogram.
And how was Lana diagnosed? I mean, what is the best diagnostic? I mean, do you do EKG? Do you do a number of different diagnostic tests to kind of confirm?
Well, an EKG is a good starting point, but usually you need to have an echo or a transthoracic echocardiogram, which is an ultrasound of the heart valve, which actually shows some pretty good anatomy and can show the problem, can make a diagnosis directly from those images that you obtain.
And then you ended up diagnosing Lana, and so tell us how you guys became connected. Are you the surgeon that performed the surgery?
Correct. I am Londa's surgeon. I had the honor of replacing her heart valve, which was quite a privilege, and it's excellent to see that she's doing so well. So I think the number one message is that it seems really scary before you have a diagnosis. Once you get a diagnosis, I think it gets even a little scarier, but it's important to follow through and get it taken care of. So I didn't actually make the diagnosis, but then she was referred to me by a cardiologist.
Got it.
And then when she came to me, we talked about valve options and we took good care of her.
I'm sitting here looking at Londa, and obviously you took great care of her. She's very enthusiastic and very outgoing, very bubbly. Physically, she looks fit. Londa, jump in here and tell our listeners what you're doing in your life now, because you're very active.
Yes. I actually just graduated from my cardiac rehab,
Congratulations.
where I was the youngest one there by far, so that was great. And back to soccer. I'm playing soccer again, indoor soccer, a couple nights a week, and hope to be back to maybe doing some CrossFit again here. We'll see how that goes. But yeah, it's been great. I feel wonderful.
How long did it take you to recover?
It was quick, way quicker than I thought it was going to be. I think I was back driving after 3 weeks.
Now, Dr. King, are you doing these surgeries? Because in today's world, we hear this word minimally invasive surgery. I know some of these techniques in cardiac surgery are pretty fascinating. Are you doing this open or are you doing this closed?
Correct. The good news is there are so many different approaches to the aortic valve today. We can do it transcatheter. We can do it through a small incision. We can do it through a full incision. It just really is kind of tailored to what you specifically and individually need so that we can get you through safely and get you your best long-term result.
And are you using a mechanical valve or a pig valve, a biological pig valve these days?
Again, the valves are on an individual basis. We tend to use mechanical valves in younger people who are hopefully not going to need a repeat operation somewhere in their 60 or 70 years of age. People over the age of 60 or 65 tend to get tissue valves or pig valves, and those tend to last the rest of their lifetime.
Right. Well, as we wrap up here, both of you, thank you for joining us. Londa, congratulations. I'd like to see you do 20 push-ups right now. No, I'm just kidding you. Dr. King, I'd love to have you come back because I'm fascinated about what you do in your work, and I want to find out how you learn this skill. Okay?
Thank you.
So thank you both.
Shannon, although we talk a lot about physical things, heart disease obviously is something that has to be contended with, and a couple of great guests to talk about that today.
Absolutely. Like we said in the interview, heart disease is probably the first or second cause of death in America, with everything that we have. So,
right.
Yeah, really important we talk about it.
Thanks to them for being with us today. We're going to be back with our final segment right after this time out on Como.